For the last 150 years, dentists around the world have used mercury as a major component of so-called silver amalgam fillings. A cheap, malleable, and toxic heavy metal, mercury is more poisonous than lead, cadmium, and arsenic. According to the International Academy of Oral Medicine and Toxicology, a nonprofit scientific research organization, amalgam fillings continuously leak a dangerous vapor, which is a neurological and reproductive toxin, and has been linked to numerous diseases, including chronic fatigue, cancer, ADHD, and Alzheimer's. As a result, many countries have banned the use of mercury fillings altogether. Despite evidence to the contrary, the American Dental Association continues to claim amalgam fillings are safe and even prohibits dentists from sharing the dangers with patients.
I scheduled an appointment with Dr. Kevin Bohm, a holistic dentist based just outside of Chicago, to learn more.
In his practice, Dr. Bohm offers the same services you might find at a traditional dentist, including x-rays, coaching on dental hygiene, and cleaning.
When you're flossing, if you haven't been doing it, because those gums, just like, muscles when you're working out, need to get in shape.
But what sets him apart is an extraordinary commitment to treating patients holistically to ensure their long-term health and wellness.
It's just a matter of looking at everybody as an individual, which from the seat that I sit in, you have to do. You cannot treat everybody as a rubber stamp or a blanket statement. It doesn't exist because your body chemistry is different than mine.
So what we're looking at is the bacteria that's in the plaque. Okay, we're looking for any signs of periodontal disease, inflammation.
Oh, what is that?
It's bacteria.
Swimming around.
It's in your mouth. You have to remember that this bacteria is not only in your mouth, but it runs throughout your system too. So especially the periodontal bacteria, if there were spirochetes on your slide, those are the bacteria that cause periodontal disease, heart disease, diabetes, pancreatic cancer. So all the more reason that we want to keep everything as bacteria and as plaque-free as possible.
We like to try and involve as much natural medicine and nutrition, perhaps, as is humanly possible. We do quite a bit of homeopathy here in the office. The body knows how to heal itself. It's just, let's get out of its way and let it do the dirty work for us. All sometimes you have to do is kind of nudge it in the right direction. These are natural substances. This is what God intended. And should we be doing a little bit more of it? Well, personally, I think so.
One of the treatments he offers is the safe removal of mercury fillings.
The way that we remove the mercury for you, the patient, is as safe a way that has ever been devised. I mean, it's trying to protect you the best way that I know how with both the rubber dam, doing a little bit of either charcoal or chlorella to help absorb whatever might try and get past that rubber dam. So at least you don't have a chance to absorb anywhere near the amount that you might have been able to absorb if we took no precautions at all. Obviously, we have some other fancy gizmos up here, in the ceiling that are designed to help try and eliminate mercury from the office, because again, I'm removing it every day. A whole office air scrubbing machine. Basically, it's an air purification unit. A mercury filtration system that is built into the wastewater, because obviously, once it is removed here in the operatory, well, it goes into the waste lines. From there, we've actually got one of these apparatus. It only behooves the rest of us, because once this goes out into, the sewer system, well, are they able to get all this stuff out of there and reuse the water? Well, I don't know. Can they? I don't know the answer to that question, but at least from what we're putting out there into the rest of the world, at least that's one thing that I know that, thank God our offices aren't doing. There are going to be certain materials, like I say, that perhaps, in your own body chemistry standpoint may not necessarily be the greatest choice for you. Is it going to be something that potentially harms you? Those instances might be rare, but nevertheless, is it worth taking that risk? I don't think so. What we use here in the office is not only the blood testing modalities, but we also use applied kinesiology, among other methods, to try and get some better results for patients through the proper application of science. This is something that you will possess and you will use for the next 15 years. It's part of you now. doesn't it make more sense to try and use our heads ahead of time to try and find some safe materials for you that we know darn well are going to work with your particular body chemistry? I think the answer to that question is always going to be yes. Here's one of the old fillings. Anything that is metallic based, what you and I are looking for is, are we starting to see some areas where you can see either blue, gray, something that would indicate to me that we now have a blown seal around this, or we're getting leakage around it. I mean, there's a lot of different ways that you can describe this, but once you actually start to have issues around here and around an old filling, this is something that is very, very easy just to eliminate this now while it's a small problem rather than leave it become a large problem.
Upon weighing the research myself, and after 20 years living with a mouthful of mercury fillings, I decided to have mine removed. Before surgery, Dr. Bohm referred me to chiropractic Dr. Elizabeth Bartlett, who specializes in complementary medicine.
We use these 2 points based on the Chinese model of medicine. The Chinese theory is that we have energy traveling through our body. So at certain points on your hands and your feet, we can measure the energy according to the different organs and organ systems at those points. We don't use it as a diagnostic piece of equipment at all.
Okay.
We use it to, basically what we're doing is tapping into the body's communication system and letting your body tell us what it needs and what it wants and how it's feeling.
Oh, the red zone.
The red zone.
So what does that mean?
Well, basically what it means is for one reason or another that tooth is stressed, okay? And it may be something, a cavity, it could be there's an infection in there, or there's virus, bacteria. I mean, we all have bacteria in our mouth, but just may have an overabundance of them, or even heavy metals, could show up energetically on here saying that, hey, we need to do something about this.
Like mercury.
So, mercury is a great example.
Okay.
Doing okay so far?
Yes.
Okay. Are you having some problems? Is that where your problem area
Is
is?
this the left side or the right side?
Right.
No, not that
No?
I know of.
Okay. Okay.
Guess that's why I'm here.
The next little part of this is testing the dental compatibility with the different dental materials that Dr. Bohm uses.
So my body won't like that one.
Correct.
Interesting.
Correct. So out of the other anesthetics that we're going to test here, we're going to try to find one.
So precise. Oh wow, that's right. Like perfect
That's
balance.
right there.
Nice.
Awesome.
From Dr. Bartlett's testing, I have a number of materials that would be solid for you, and there's a couple that, again, are not maybe the most ideal.
Next, Dr. Bohm administered an anesthesia complementary to my body chemistry, then began removing the mercury fillings.
I know it looks like something out of a Ray Bradbury movie, but all right, it's time for us to look like we're from Ray Bradbury also.
The rest of this is nothing but just a couple of cleaners, basically. This is placing the actual resin or the new material that is metal-free right inside of the old place where old filling, old decay, and all that used to be. The bright blue light just cures the material.
Where we had two small areas of decay in between the teeth, there's one small filling that extends through here, the other small one that extends through here. This one back here where we had a little bit of decay around the old filling that was here, and that's all been put back together. You did magnificent.
Thank you, so did you.
You, like I said, you got the hard job, Jerry. I don't.